There are examples of countries that have institutionalized NASA. Many countries in Asia-Pacific, some in Eastern Southern Africa, and quite a few countries in Latin America and the Caribbean have actually institutionalized NASA. That also means that they fund it through their domestic resources on a frequent basis, once every 2 years, as per UNAIDS recommendation. There are many countries that rely on external donors to conduct the NASA, especially high disease burden countries with low income status. They continue to rely on donor support to fund NASA's. But in terms of what is the cost of doing NASA, I believe that's also a relevant question here. It is in general less than 0.5% of the total resources in the country. It can depend from country to country. For example, if you're talking about a country with hundreds of millions of dollars, the cost of doing a NASA can be less than 0.01% of the country. But in a country, let's say hypothetically spending $10 million a year, the cost of doing NASA, assuming it is done once every 2-3 years, is less than 0.2%.
In a variety of ways, some countries can fully fund it themselves, though through the National AIDS Council's budget, and I know a number of countries that do that. And they are the ones who've committed to NASA. They know the benefits of it, and they have put it into their annual budgets. There's also funding available through the UNAIDS and USAID, and other development partners have put money, and Global Fund have put money into supporting countries to do their NASAs. And because they see the value of the data, not only for the country, but for themselves, so the development partners have a good sense of what's going on. So those really are the two main sources, the government budget themselves and then from development partners, yeah.